afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy that you chose to spend this time with us. I will use my prerogative and say I think we have a very important topic to discuss today, and we have just the person to discuss it. Without further ado, I will turn it over to our founder, Dr. Randall Maxey.
Good afternoon, everyone. Thank you, Dr. Barbara Neighbor-Stevens. And today I'm honored that you came up with this topic and you're very passionate about it. And the rest is history. We'll talk about it. My message in church today was about covenants and how human beings are made in the image of God. But God has said that we have broken a number of our covenants. And recently, our U.S. administration has continued breaking covenants, especially covenants with some of the founders of our nation, meaning people of color. But I'm very honored, and I'm asking Dr. Neighbor-Stevens to introduce our speaker, who is the 127th president of the National Medical Association. And we're honored that she accepted our call to educate our community. Dr. Barbara Neighbor-Stevens, would you introduce our speaker?
It is my honor and privilege to introduce our speaker today, someone that I have known for a long time, early in her career, and I've had the joy of watching her mature into the professional that she is. She is a native of Houston and attended Duke and undergrad and Baylor Med, did her pediatric residency at Johns Hopkins, and is a former Robert Wood Johnson Clinical Scholar at University of Pennsylvania. She has already in her short career achieved notable success and is a recognized leader in the area of pediatrics. Without further ado, I am honored to present our speaker for today, my colleague, my Sora, Dr. Brandy Freeman.
Thank you so much for having me. It's a pleasure to be here.
Thank you so much. So we have a lot of discussion, and I know you wrote a major statement this week on behalf of the National Medical Association. And would you speak to what's going on and what the controversy is and what you see our major problems are? I see that we've been betrayed and somebody's trying to kill our kids. Maybe I'm being dramatic, but I intend to be.
Oh no, I very much appreciate the opportunity. I think, what happened this week is the federal administration put out a executive order that is seeking to change the recommended vaccine schedule for our children. And the reason that's really concerning for the Black community is that we already see lower levels of vaccination. Our families in the Black community are already at higher risk for these conditions. And so by putting out this order that is not scientifically based, I think that's the key thing that's important in it. The administration has just decided that they want to do less vaccines like other European countries, what is being put up as the example. There is no evidence that that would work in the people in this country. There is no evidence that the number that it would work for the different types of populations that we have in this country, and it is going to put our children at risk. And so, we, as the National Medical Association, our statement was in opposition to that, really recommending that we only are doing evidence-based approaches to scientific or scientifically based and backed approaches to vaccination. Vaccines that are administered to children today have gone through years and years of testing before they're ever given to our children. And we have been able to get to a point where we don't see certain diseases. But that is because of the vaccination and the immunizations that we have been doing over time.
Well, let me ask you a question. I know you have a lot to say, but what exactly in layman's term is a vaccine and why are people afraid of them? And why are we introducing such a discourse among our people who are already afraid of things. What is a vaccine and why is it good?
Yeah, so in is people might remember, they'll remember that they think of a vaccine only as a shot, but what it really is, it's a way of teaching your body how to fight and recognize a disease. So, and this is before you come in contact with it yourself. Sometimes I think of it as kind of a blueprint, a roadmap to tell your body when you get or come in contact with this disease, this is what you should do. It's kind of a practice session for the immune system in a way. And they allow our immune system to know what to do and have a response ready if it was to come in contact with that illness and to protect the body. That's why, if we come into contact later, your body's ready. And, so it's basically your game plan for combating an illness. The way they're administered are usually through an injection, so a shot. There are a couple that are given by mouth. Most of them are shots. And so there's often a little bit of pain that's associated, but it's really a long-term plan to help protect your body and your health overall.
Okay. Dr. Barbara Davis Stevens, do you have a comment or a question?
I want to make a comment first. I don't know if you have had to treat anybody with any of the diseases that we are, and I guess we should name them in a minute. But in my practice, over the course of the years, I have gone from being at the bedside of children literally coughing their guts out to a child who developed brain inflammation and infection from chickenpox to a child with measles who fortunately did not go deaf, but did develop a very severe pneumonia. So these are not innocuous diseases that we are so concerned about. And I think if anybody sat by the bedside of a child, and it could hit any child at any age if they're not vaccinated, and see them struggle to survive when there is something that can prevent them from having to go through that experience, you might be able to understand my right, as we used to say, righteous indignation over the just the audacity of the administration to try to create the problem that they are in the process of creating. All right, so I'll try not to preach anymore. My question is, there is an attempt to portray the United States as being overzealous in the use of immunizations. But in fact, we are right along with most of the rest of the world in terms of the normal vaccinations that are given to kids. We're at 17. A lot of countries are at 14 in terms of individual immunization. So it's not like we're out there doing something crazy. Sorry about that. What we're trying to do is protect our kids. So could you speak to the actual immunizations that are in question and try to debunk some of the mythology that's being put out about what we're doing to American children?
Yeah, so I think one of the things that's been most prevalent in media and the news, and that this administration seems to be going after, is the MMR vaccine. And so MMR, or the measles, mumps, and rubella vaccine, it is a combination vaccine that is given to children at the age of 1, usually. And then once again, you get a booster shot at age 4. The administration seems to be focused on the fact that there was what has been proven to be, and the author themselves said basically they lied when they put out this study that said that caused autism. It's been debunked over and over again that vaccines do not cause autism, but people seem still very focused on it. And so one of the things that this most recent executive order wanted to do was to separate that vaccine, to give it into 3 separate shots as opposed to the combination vaccine. There's no evidence that doing that, one, we already know it doesn't cause autism, but 2, there's no evidence that separating them changes anything either. If anyone's ever given a vaccine to a child, giving 3 versus 1 is a little bit different. They're not very happy with you at the end of that. And so I'm like, why would we do that to a child? That's one of the things that they remember more than anything else. But, the other thing we're seeing measles there are outbreaks of it across this country. Right now, I have not personally seen it. I did not think I was ever going to see measles in my professional career. Unfortunately, the residents I train now have seen it because we are having it in our hospitals. I have residents who've taken care of multiple cases of measles now. And so, I think one of the things that's really important to think about when we think about the state of our country, that the absence of these diseases was not evidence that we don't need vaccines. It was evidence that the vaccines worked. That's why we weren't seeing them. And, we've got to think about, there are other countries around the world who have never been able to get rid of these diseases. They've never got rid of these vaccines. We did in this country because we had a very proactive immunization program. And now that's changing.
Wow. Dr. Ivan Wilkes.
Good afternoon, Dr. Freeman. First of all, just thank you so much for being with us. I think when Dr. Maxey envisioned Black Health Trust, he envisioned this kind of a proactive statement from someone of your caliber coming in and being able to share with us the truth about what's going on. I don't think Dr. Maxey was being too dramatic when he kicked off the program. I think that there is certainly, at best, the kindest way to say it is there is a level of recklessness in this dishonesty. And there is a level of dismissiveness when it comes to the already stark disparities that impact our community and therefore our children and children of color. So my question for you is, how did we get here? How did we as physicians, how did we as leaders in our community, how did we as people of color get to this point where now we have to say, don't listen to them? I would think that somewhere along the way, we would have been able to fortify our community against listening to them. It's not that there is an order that says you have to change something that's been working. The order is we are going to change this recommendation. And now we're saying, wait a minute, don't listen to their recommendation. Not don't follow the law, don't listen to their recommendation. So I just want to understand better how you feel we got to where we are. And then in addition to giving this advice of don't listen to them, how do we prevent every time they wake up with some notion we are at increased risk?
Yeah. No, thank you so much for that question. I spent some time thinking about that, like how did we get here, where it's kind of been this reversal or this questioning of science. And I think, there were lots of factors. I don't want to blame everything on COVID, but I think there was a lot of different information that was coming at us quickly during that period of time. I think we're also in an environment where the ability to put out information, whether it's real or not, it's very easy in terms of how people can access information. And so then for individuals, for our community, we're at this point where you do have to try to vet the information in the right way for yourself, for your family, for your community. One of the things I always recommend is to have that conversation with your trusted medical provider and making sure that they, it's someone who has the credentials that, and if there are things that you see, online, see on whatever social media platform it is, that you take that to them and have a conversation with them. I think one of the things about vaccines, I had an experience of a family I take care of where this was a family who did not believe in vaccines. And we can talk a little bit more about, people's beliefs and differences about vaccines in general. But during the COVID pandemic, the child was reading different things online. And so he brought that into clinic with me for us to talk about. And we were able to have that conversation about how vaccines work, what they're doing, what the research behind them is, how they're developed. And then they were able to decide for themselves, and they decided that they would vaccinate at that point in time. They got the COVID vaccine at that point, and then actually did all of the routine vaccines as well for the older child as well as his younger siblings. But it's because we were able to have that conversation. I think as we think about, the Black community and what are, I think of it often as an attack is what is happening. It is a kind of a, whether it's a Trojan horse that's being put out there as making it look like we're trying to protect them, but there's actually a harmful virus inside of it. There is something harmful that is coming for us that we really have to take into account and question some of the things that are coming and making sure that we are going to those people we trust in order to get the right information.
Well, thank you so much. It's important that on the Black Health Trust, we've got 2 primary care doctors, a pediatrician, and myself, primary care. But we have 2 psychiatrists. Our second psychiatrist I'm going to call on now, Dr. William Lawson. You have a comment or question for Dr.
Yeah,
Brandon?
thank you, Dr. Freeman, for your excellent presentation and just reminding folks that there is an organization like the National Medical Association that are forwarding the interests of African Americans. As a former editor of a journal, the Journal of the National Medical Association, will let you know that there is a journal that's trying to maintain high standards and also quality information. Just want to note that, I don't know, maybe I'm showing my age, but I've had several patients that had developed polio. And I've had patients who, in fact, developed the dementia that's associated with measles. We don't see it as much now, but it does occur. And I was involved in the ongoing crisis that occurred. And unfortunately, this is not new in our community. I was involved with a lot of discussions around polio vaccine, HIV, saying, is this an insidious plot by white people to inject us with something that's going to sterilize Black men and make us go crazy, or in fact, to exterminate us? And there are still many people in our community who are making these kinds of statements and who actually have strong beliefs around this point. I think one of our challenges is not just them, but also us, to make sure our providers, as well as folks in the community who mean well, recognize that vaccines wasn't a white man's creation. Dr. Williams has written in his book, excellent story about how it was promoted by a slave who eventually got the idea to be accepted in the U.S. This is not an issue of some overarching plot by white people to put in some new technology that's going to harm African Americans. This is a standalone, it's a treatment that's been around for centuries that we'll now begin to benefit from precisely because we brought it to this country. I'd like your thoughts about that, Dr. Freeman.
Yeah, I think that's right on target in terms of thinking about the history of where vaccines came from. And, I understand, what is said in our community and why. Unfortunately, in the United States, there have been experiments, there has been research that specifically targeted the Black community. However, I think that history is what warrants, makes it important to, one, have Black physicians, people who are not only a part of our community, but are committed to taking care of our community, and why organizations like the National Medical Association are important. We were founded in 1895 because of the need to make sure that we had the academic availability of information to make sure that our doctors had all the information they needed in order to take care of our community. And that's why, in terms of, what is happening right now, I think it's really important to know that vaccines are vetted. I think, providers who are giving them, such as myself, that, we have the ability to not own, or the ability to not only, understand what is in the vaccines, but that we are able to vet what we're doing and what the understanding of the science behind it. But it is an idea, as you said already, that came from our community, I think. And it is something that, in terms of taking ourselves, the science, that process, is really important to think about how we're going to preserve our health.
And so we know that the history of vaccines did start in Africa, where a slave showed Dr. Jenner what vaccinations were. But I've got a bunch of grandkids,
Mm.
and some of them range from the age of 4 to 2.5 to 1.5. So what is this injection that they're supposed to have? What is the MMR? And why does our president think that my grandkid would rather have 6 injections than 2 or 3? And what exactly are these vaccines? What's in them?
Yeah. So I think I can't explain the individual who lives at 1600 Pennsylvania Avenue. I can't explain his rationale related to that, because to me it's not it doesn't make sense.
You got 2 psychiatrists, right?
Yeah, maybe they can explain it, because I cannot explain that one. But in terms of what's in those vaccines, so they are against specific conditions. So the measles virus, the mumps and rubella viruses. And those are ones that cause those specific illnesses. In that form, the measles, mumps, and rubella is live vaccine. So what you're getting is a small amount of the actual disease in order to give your immune system the roadmap to create its own immune response to it. That's why, when we talk about, people can feel like some people probably remember what happened when they got their COVID vaccine. They felt pretty bad afterwards and were questioning the vaccine itself. It was your body creating the plan, creating the immune response to it. And that's what made you feel so bad. I remember, actually, when I was in residency, I got the flu vaccine and ended up with 102-degree fever. I was like, oh my gosh, I have the flu. What is going on? However, it lasted 24 hours. And then from then on, I realized, okay, that's fine. If I can do that for 24 hours, I'm fine. I would not want to do that for a week or have any of the other complications that came from it, where my body had an immune response. And that's sometimes what we feel that makes us feel so bad. But it's important to recognize that then it goes away. It's like your body created that roadmap for itself. It's able to remember that and then to keep going forward. There's no benefit that we know of in terms of the MMR vaccine, specifically in terms of splitting that up. To do that 3 different times. The combination vaccine has been through endless types of clinical trials to understand the safety profile of that vaccine. And we know that it's safe to give them together. And they're, just thinking about the benefits in terms of, the harm versus, like if you ask any of my patients, especially the ones who are 1 to 4, none of them ever want a shot, right? They never want that. And so if you ask them, they're going to tell you, please do not give me 3 just because you made up the idea about it.
One of the proudest days of my life was in Puerto Rico a few weeks ago. And I saw an event that happened where we installed the 127th president of the National Medical Association. What happened in Puerto Rico, and what did you take away from that as you became our 127th president? And why is the NMA so important now, even more important than ever?
No, thank you so much. Puerto Rico was definitely a memorable experience for me as well, and it is it honors me for you to even say it, that it was memorable for you. So in becoming the 127th president of the National Medical Association, it is something that the responsibility and the accountability to our community that comes with that role is something that I take very seriously. We're at a unique point in time in history where we do actually have many leaders of organizations who are members of the Black community. However, only the National Medical Association is focused on the Black community's health, that it is the priority for us. It is who we are responsible for, who we are accountable to. And thinking about that and all of the mistrust and misinformation and truthfully disinformation, there's just blatantly inaccurate information that is being put out to our community, that I take the responsibility of being in this role at this time incredibly seriously, that wanting us to make sure that we are able to arm our providers with the information that they have, or the information that they need to take care of our community, to make sure that they're able to take care of themselves as well. I think there is so much burnout that we see, that there are unfortunately individuals who are leaving medicine every day. And we also have threats to the pipeline, for lack of a better word, coming into medicine. And so it's a really important time for us to think about, how do we maintain our community? How do we grow? How do we allow it to thrive? And that's what the National Medical Association is focused on. The theme for the year is ensuring our living legacy, elucidating the NMA blueprint for generational health. And in that sense, what I want us to focus on is, what is our legacy advocacy, our legacy of being the trusted community provider, but thinking about, how do we plan for generational health? What does that mean from all aspects, whether it's thinking about cancer or maternal health or pediatric health or HIV or mental health, whatever it is, what is it that we need to be focused on for our community so that we can have our best health, our optimal health, and we are able to give that to the next generation.
So as I bring the next person on to ask you a question, am I right that the NMA consists of something like 27 scientific sections, and we have the best CME in the world, better than the AMA, anybody I've ever heard? Talk about that, just our breadth of sections and sciences and how we divide up our education.
Yes. So I think that's one of the great things about, or one of the most beneficial things about the National Medical Association. I'm a pediatrician. I go to a lot of pediatric conferences, but at NMA, because we represent the full breadth of medicine, I'm able to go to dermatology sections. I'm able to go to surgery sections, emergency medicine, psychiatry, community medicine, and public health. Across the board, I'm able to have a full multidisciplinary approach to medicine, is what I can actually do through the CME, or continuing medical education, that is provided at the National Medical Association. I'm also able to network and learn from those providers. There is a different approach that OBGYN may have to something rather than me as a pediatrician, or a psychiatrist may have rather than me as a pediatrician. And we're able to learn together in that environment. We're also really able to prioritize those issues that are impacting our community. I think for pediatrics, I can say I have never seen better sickle cell information provided than at the National Medical Association. Truthfully, I have not seen it provided in many regards at all at other organizations. So it's really a place that we are able to come together to learn and make sure that we are able to have the best science and best information to take care of our community.
Excellent. And as I bring on Dr. Barbara Neighbor-Stevens, one of the things I learned was the effect of things like the weight loss drugs on women who are pregnant and how they can get through to the fetus. Dr. Barbara Neighbor-Stevens?
Thank you. I'd like for us to delve a little further into what our response as individuals needs to be, as well as what our response as a community needs to be. And I want to go at this by taking the layers of the decision making and the implementation of those decisions step by step. Because what we're discussing today was an executive order, but that executive order does not and cannot, well, let me not say what I was thinking. We cannot change state law or any of the recommendations by professional organizations that have dedicated years to supervising the vaccination program in this country. Because the reason I want to get into that is this is not over. I am sure as I'm sitting in this chair, that there will be attempts made at the state and local level to make changes that have more teeth than what this executive order has started.
Yeah.
Fran-
So I think you're right. What do we need to be doing from an individual standpoint and from a community standpoint? One, I think at the community level and the state level, there are states that have started shifting to make sure that they are able to. So when we saw ACIP, or the Advisory Committee on Immunization Practices, changes in terms of their makeup and the recommendations they were making. There were some states that decided that they were going to change the wording in legislation to make sure that they were able to adhere to scientific or what they felt was more appropriate scientific information. And so the NMA endorsed the American Academy of Pediatrics plan or schedule for immunization practices is what we have done from that perspective as an organization, and can be done at the state level as well. I think for individuals, one of the things that I think about, it keeps being put in this executive, it's actually even in this executive order, is the word shared decision making. And it's always it's an interesting phrase to me, because it implies that it's something that we're not doing. That, because they're adding this in, like it's new to do shared decision making. As a provider, as a pediatrician, I have never done anything without the permission and without discussion with a family. It is a standard for us to do everything as a shared decision between a parent and between a shared discussion between the physician and the parent. We do not give vaccines out at McDonald's. It is something that happens in an appropriate professional environment. And I take that phrase now to say it is something that we are fine. If they put it out there, presuming that we didn't do it, we already do it, but making sure as an individual that you are having that discussion. So if there is something that they have said, oh, shouldn't be recommended, make sure you have that discussion with your provider in terms of, is that the right decision for you? So an example I had a patient who came in who, due to their age, they had not had a pneumococcal vaccine. And so my nurse went to the CDC website, and the CDC website said that nope, because of their age, they didn't need it. It did have a star next to it, and it said, if, for special conditions, right, that it could be considered. So I discussed with the family. The family did actually the child had a history of asthma. So had a underlying respiratory illness. And so the blanket recommendation from the CDC was no, not to vaccinate them. However, for this child who did have asthma, had a respiratory condition, it was something that should have happened, and was something that just together with the family, we were able to decide. So, I think for each individual to make sure that you're owning that process, to ask if a recommendation is being made for not something for you, asking them why. Why is that not what is being recommended for me? And is there something else or something that should be recommended that has not been part of the standard of care anymore?
Would you also include in your remarks what we as citizens of our local and state communities need to be watchful for, which is what I'm very concerned about.
Yes, so I think that is something else as individuals, as members of any organization, just civically minded people, make sure you're paying attention to what is happening at the local and state level. So whether it is with the coming midterm elections, that these are state and local legislatures that are able to enact positively or negatively what can happen with your health. These decisions are being made. A phrase that is being used kind of fairly frequently is that health is on the ballot this year. And so when you're thinking about what is happening, making sure you're paying attention to those local orders, to those what your state legislature is doing, what is being passed, and being an active participant in that process is going to be a key action that everyone can take at the state and local level.
What are some of the organizations that we are acting in concert with, like the ACIP, the AMA, and what medical organizations are we in lockstep with to turn this stuff around?
So right now, who we've been, there are a lot of there's new coalitions that are being formed in terms of there's a group that's called the Vaccine Integrity Project that we have been able, as part of the National Medical Association, to be part of. There's also a vaccine equity project as well. But we are very much working with the American Academy of Pediatrics, the American Association of Family Physicians, the American College of Obstetricians and Gynecologists, to make sure the ACP, American College of Physicians as well, to make sure that the appropriate information is available to our communities. We are working with the American Medical Association as well. I think one of the places where the medical community has been able to come together is in the need for evidence-based information to be what is used. Unfortunately, ACIP has it was once regarded as the top source for immunization information for our country. With the changes that were made to the composition of that group, we've not yet seen, there's been some legal battle around it as well, but we've not yet seen it reconstituted to the point of where it is being looked at as the standard it once was. And so I think the coalition between the organizations, the medical organizations, has really been what has been important. And as the National Medical Association, we have been making sure that we vet that information for the Black community.
Thank you. Dr. Ivan Walsh?
Thank you, Dr. Maxey. Dr. Freeman, this is really, really good. This is such an important conversation for us to have. Let me take my psychiatrist hat and put it over here for a minute and put my state public health officer hat on, because I was a member of ASTO, and I don't think that we can afford to understate the risk that is going on. We keep saying, oh, there's craziness going on in the administration, and there's craziness on Pennsylvania. It is not really. There is an intent to sow distrust and mistrust, because if you can sow distrust and mistrust, then you can continue with the other part of this that we don't talk about often enough, which is if I can give you less treatment opportunities and options, and I can make you more sick at the same time, then all of the stuff that Dr. Maxey talks about becomes a much clearer picture. There is a coordinated effort to give us less treatment options, to make us more sick on the front end, and to do that by having mistrust and distrust. So let me not celebrate the problem. Let me talk as someone who actually worked with the Robert Wood Johnson Community Health Councils projects in Southern California, who currently sits on the board of the Leadership Council for Healthy Communities. And what all that is about is getting our doctors out of our offices and into the communities, partnering with churches and community organizations, not being unfamiliar faces. Next Saturday, our church will be in a large park giving out backpacks for back to school and talking with young people and including young people in those conversations. And I just want to, and I know the NMA does all of that kind of stuff. And so I want you to talk a little bit about how the NMA is actually out of all those wonderful research halls and all that fancy stuff and doing community type projects that make our faces familiar faces and trusted faces so that when we do get the coordinated, aggressive foolishness that comes out of places of people that don't care about us, well, they do care about us. They care about hurting us and making us more sick. I think they do care about that. How can we support the NMA's efforts to be in our community and make us those not just trusted professionals, but trusted partners in the community?
Yeah, thank you so much for that question. I think, the NMA, that is where, when I say that the lifeblood of our organization is the work of our members, our local societies, and it shows up in so many different ways. I think one exciting thing that is coming, so it's actually our Violence Prevention Council is working to activate this in many states across the country, but on September 12th is going to be doing Walks for Peace. So really making sure that our docs are out there, that our community is aware of the threat that comes to our community in the form of violence, whether it is individually mediated, whether it is, mass shooting incidents, but just the awareness that happens from gun violence is one of the things that is going to be coming. I know it is activating in Detroit, in Chicago, in Nashville, in California. I believe it's in Southern California that the activation is. We're working on getting Northern California on board as well. But really is one of the things. But there's, that's just one example of something that is happening. I think there are docs who are giving vaccines through clinics. There are docs who are raising money. There are docs who are giving advice, just being that person. And, I live in Colorado. There are not a lot of pediatricians. There are not a lot of doctors, period, who look like me. So when we have local events, one of the things our local society does is just try to be present and allow people to have more access to us and do an ask a doctor table so that anybody, whether they're our patient or not, can just interact with us, because we realize we cannot actually take care of everyone, but we want to interact with our community. And so there are just so many different ways. One of the things that I'm actually trying to do for the National Medical Association this year is having a local society best practice kind of resource network, as for lack of a better word, right now, but where our local societies are able to learn from each other, because there are really there's such rich information. There's so many rich programs that are happening around the country that we want to have those best practices available so that they can be multiplied in other places.
Excellent. Dr. Lawson? Is Dr. Lawson unmuted?
Not yet. He's on his way. Dr. Lawson, we need you to unmute,
There we go.
sir.
I think we should not forget the subtle little points. One of the that I don't think many the audience realize how important it is this idea of separation of vaccine. As many of us who work with the comorbidities that are faced in our community, separation of mental health services, separation substance abuse services, as well as general medical conditions, having to go to multiple providers, which many people just don't have the resources to do. This really impacts the ability to get services. And the bottom line is not just what's happening at the government. Ultimately, the decision is going to be made by the parent. And if the parent says, this is too much, I don't have the resources, I can't do it, it ain't going to happen. And I've seen this repeatedly stated over and over again. I have a relative she said, this is too much a hassle, all this stuff of vaccines and, throw this stuff away. And there are prominent people on talk radio who are going around and saying, so what? Take measles, go, get it over with. Get smallpox, get whatever you got. So I think Dr. Walks hit on a key point, and that is that it's not just convincing physicians. We also got to work collaboratively with our community leaders as well as with our people in the community, average dude walking down the street, that this is something that needs to be done. Dr. Walks involved with the church. We got to get our fraternities and sororities involved. We got to get our real leaders, our barbershops, our hairdressers, and others aware of these kinds of issues because they're the ones that's going to have the impact. And folks don't, and of course, we got to make sure that the weird stuff on YouTube and other places doesn't really have the influence that it does. So we have much more media, much more information, but at the same time, we have stuff that's getting out there that's just bizarre.
Yeah.
And Dr. Freeman, I don't know if you could say some more about what the NMA is doing to make sure that what's being put out on media, social media, and in our local communities, what can be done to address those?
Yeah, I think that's a really great point. I think one of the things that I is being taken advantage of, I think, in terms of related to vaccines is related to people always say that the Black community is mistrustful of vaccines, and that's why we have different vaccine rates. There's a key point that they're missing. We also have less access as well. And so this point of, we're going to make you have to, we're going to separate the vaccines, we're going to make you have to come for more visits. And so when you already have less access, and then you want to try to require more access to do it, it's going to create even worse rates for our community. And I think so some of the things that are being put out, are the NMA is definitely in support of making sure that things are accessible to our families, to our community, and however that means. So partnering with different organizations during COVID, many NMA local societies were partnered to make sure that the vaccines were available in our communities. We were giving the vaccines ourselves at that point in time. And so making sure that access and partnership allows us to do that. So there are local societies, you spoke about barbershops. That is a great partnership that has been, I think, I know has been at work in California, has been work at other places as well in terms of Black barbershop. Initiatives. We actually have one in Colorado as well of pairing health information, health screenings with community initiatives. So in the barbershops, in the hair salons, that sort of thing. But making sure that access and however we can do that is part of it, I think is really key. In terms of combating the different types of information, as an organization, we are really trying to be proactive and making sure that we are able to get out information in a timely manner to our members and to our community using our social media portals and that sort of thing. We're also looking to do some partnership with other organizations that have access into the Black community in terms of making sure that there is trusted information available, however families want to get it. So if they are seeking it through Facebook or online resources, that there is information that is not just coming from, someone who is not doing it with the evidence behind them, but is able to do that in a manner that is seeking the best interest of our community.
Well, thank you so much. I'm going to take a prerogative as the 104th president of the NMA. Are there any other past presidents of the NMA online who would like to be unmuted in a moment and ask a question or make a comment?
No, I don't see any.
Okay. Well, let me say this. This has been a great session. I think we've covered an awful lot. So in our last few minutes before we hit the top of the hour, I'm going to ask Dr. Freeman to freelance for a moment on what other messages she wants to give us from the NMA and being at the top of Black medicine.
Okay, well, thank you. I really appreciate the opportunity to be part of today's segment. When I think about where we are right now and what the future holds for not only our community, but for the National Medical Association, and I think about the assault, for lack of a better word, that is happening to our community, I think of about three things that are critical. So one, truth. We have to make sure that we have truthful information available to our community, that we are defending science, that we are telling the truth, and that the recommendations that are given to our community have the best available evidence-based information for them, whether it's related to treatment, scientific review, and that we tell the truth to our community about where we have made strides and where we still have work to do. That we have to protect the trust that we have in the community. We recognize that truth isn't just something that we can say, well, just trust me. It has to be earned, and it has to be earned through transparency, listening, and accountability. And we have to really fight the mistrust that is, or fight the misinformation that is present in our communities. And we have to advocate for public health policy that is being done, whether it's in our, local governments or our state governments, to make sure that those impacts that are felt in our homes, in our schools, in our churches, and our clinics, that we are making sure that it is the best available for our community. The National Medical Association has existed for over 130 years. And I know at this point in time, it is not our job to be quiet. It is our job to defend our community. It is our job to defend equity. And we have to do that by being more visible and more engaged. And so when I think about, in closing, what this moment really calls for, that we have to continue to do what we've done for more than a century. We have to tell the truth, we have to build trust, and we have to advocate for our communities to make sure every family has both the information they need and the opportunity to reach their best generational health.
Thank you so much. Where's that convention next year?
Look forward to seeing everyone in Baltimore, Maryland, July 31st to August 4th of 2027.
And we're going to give you a cane, right?
Yes, that I've heard that's the more fun side, but yes.
Okay.
So, Randall, may I follow up on something that Dr. Freeman mentioned? She mentioned a lot, but I don't want to get lost. And I'm going to exercise some prerogative that I probably don't even have, which is to say that we have another really significant issue looming on the horizon, and I would like to take this opportunity to invite you to return and join us in this conversation. I don't know if our audience is aware that over 50% of the children born in this country are born on the Medicaid program. And the Medicaid program is about to be another political football. And when I say about to be, this is August. This is going to kick off in October. Thousands of people are going to lose their Medicaid eligibility, and horrendous new requirements have been put in place that will make it difficult for people to, if they can get Medicaid, be able to retain their Medicaid. This is a direct threat, again, as Dr. Walks was describing, and it's something that on Black Health Trust we're going to have to explore. The remedy for this is, again, political action. We can't get away from this. This is a political issue. I mean, health has become a political issue, and we're going to have to address it.
I agree 100%. I would love to come back to talk about that one. I think there is a lot of work, a lot we have to do, and a lot we need to learn and make sure our community has the best information about it. So
don't let Dr. Barbara Neighbors Stevens fool you. She's the real boss.
yes.
She is.
Dr. Maxey, Dr. Sherrod has had her hand up for a little while.
Dr. Sherrod, please join us.
Well, good afternoon. First, congratulations to Dr. Freeman, and thank you so much for sharing all this important information with us about the NMA. I am a pediatric infectious disease specialist, and I actually served on the ACIP 1994 through 1998. I don't envy your position, but I know that looking at your CV, you have the training to meet the calling. And we really appreciate you coming here today to share with us. I'm in a state of confusion, though. I mean, I'm an infectious disease specialist, so I can't even imagine what the general pediatricians are going through. And so I really like the idea that you are collaborating to bring together a vaccine integrity, I think, group that you mentioned in the NMA. But as a general pediatrician, if they call, who do they call to find out what schedule are we using now? You know, there are two out there now, the federal recommended one, and then we have the CDC recommended one. And so I'm just wondering, are you recommending, or is there a central source at the NMA that can actually put out information to the chapters, the local chapters? We have the Drew Society. We have the Association of Black Women Physicians, which was started in 1982. And at that time, we hadn't had a woman president of the NMA. So that's important for you to know. So we got our first woman president in 1984, 2 years after we began. But we will be getting calls about immunizations. Well, which schedule do you use? And what about this three, what kind of how can you bring this together so that we have a source of information that we can rely on as pediatricians? Because when they call ABWP asking about the immunization schedule and which one to use, I'm kind of confused.
Yeah, so the NMA, what we have endorsed is the American Academy of Pediatrics vaccine schedule for children. Within our organization, we do have what we call, it's our vaccine task force, and there has been a request made to actually do the same thing in terms of vetting the other vaccine schedules for adults as well as for pregnant people. So for pediatrics, we endorse the American Academy of Pediatrics. I think we actually have a link to it with our signed statement on the NMA website, but I can also go back to our organization and make sure that the pediatric section, as well as the local societies, have that readily available to them.
What is the website we give it? What is the NMA website?
NMA's website is nmanet.org, www.nmanet.org.
Thank you. Is there any before we go to final comments, Dr. Neighbor-Stevens?
Thank you very much, Doctor.
Anything in the chat? Thank you, Dr. Sherrod. Is there anything in the chat? Any questions, comments?
No questions. Lots of good comments.
Want to read one of them?
It's so great to be on today for this exhilarating topic of discussion. Indeed, we need access to more physicians who have our best interests at hand. I am in touch with a plethora of ministers/pastors, and Dr. Maxey and others can reach out for various ideas. Sincerely, Dr. Tori Bailey.
Excellent. Very good. Let's have our final comments. Start with Dr. Lawson.
Yeah, just again, want to note that this is one of, as Dr. Freeman, the multiplicity of issues that are emerging that emphasizes the importance that we help to make our community aware that the survival of our young people, our life expectancy, and everything else is now, I think, at greater risk than ever before. That we cannot, as simple individuals, try to solve these problems because we are facing a communication system, governmental issues, and others that have far more resources than this group or any other group have. So we really need to really get serious about pulling our resources together to informing our community and letting them know the outrageous misinformation effort that's being done to undermine our health.
Thank you so much. Dr. Walks?
Thank you, Dr. Maxey. Dr. Freeman, it is just such a joy to have you with us. Thank you for this incredible level of scholarship, incredible level of clarity, and incredible level of caring about the community. My comment for today is really about us being out and being visible. For any healthcare professional who is on our show or listening today, if you have never gotten up in church when it's time to do the church announcements and had something to say, if you've never gone to a funeral and been able to ask and get up and talk about something that might be helpful related to the person that just died. I did that once for a young man that died from prostate cancer. His family was happy to have me come and bring information about prostate cancer. I brought a whole bunch of stuff. All of it was gone because people were interested in taking things, and all of the student national medical associations, which can do a very positive indoctrination of young people as they're coming through the system, helping us to be out in our community, helping us to be visible, helping us to know people. And I want to go back to Dr. Gibson. I love Dr. Gibson so much. He's a pharmacist and he's always on Black Health Trust. Dr. Gibson put in the comment, know your pharmacist. The pharmacist can be such a good friend when it comes to information. And my last point I'll make is this. I don't believe in doctor's orders. I believe in doctor's agreements. And I think that if we as physicians can help people reach a point where we agree with them and they agree with us on the next step, guess what? We have a much better opportunity of folks actually doing the stuff we want them to do. Oh, and by the way, nobody takes medications 4 times a day. Nobody does that. I don't care what you tell them. So getting people to agree that what you want is something they will do is just such a useful practice. So again, Dr. Freeman, thank you so much. Can't wait for you to come back and talk to us.
Thank you. Well, that's Barbara Neighbor Stevens, the originator of our program today. Dr. Neighbor Stevens.
Why are you laughing at me, Dr. Walks? Dr. Freeman, I am so grateful that you carved out some time to spend with us today. As you know, I've already put in my plug for you to come back. We have so much work to do, and we need to use every tool in our toolbox to be able to get some of the work done. But if we all work at it and work together, we can make a dent. I have no doubt we can make a dent.
Definitely.
So, Dr. Freeman, we love you and we appreciate what you stand for and what you represent. You've done us an honor today, and information was so great. We thank you so much. Have a great, great day. Everybody, thank you, Dr. Lawson. Thank you, Dr. Walks. Thank you, Dr. Barbara Neighbor Stevens. And thank you, Simon, our tech. Have a great day, everybody.
Good day, everyone.
Bye.